Welcome to The Explainer. We're talking D2 gastrectomy and how it went from controversial to standard of care. We'll start with the D2 controversy. Look at the evidence and see how we landed on today's standard.
So what is a D2 gastrectomy? It's the removal of two specific tiers of regional lymph nodes.
For decades, surgeons were locked in a huge debate. Just how many lymph nodes should come out? And early trials out of the UK and the Netherlands seem to have an answer. D2 was actually harmful. This was a huge puzzle. Why were D2 resections in the West doing more harm than good? It turns out the main culprits were routinely taking out the pancreas tail and the spleen. But then the long-term data started rolling in, and it told a completely different story. Check this out. It took 15 years, but the Dutch trial's follow-up data was a massive turning point. And here is what they found. D2 resection meant a much lower chance of the cancer coming back locally. And the big one, fewer patients were actually dying from their gastric cancer with the D2 procedure. Now, while the West was struggling with this, surgeons in East Asia had a totally different experience. In their high-volume centers, D2 was safe, effective, and already the standard of care, with great outcomes. So this huge difference between East and West held the key to why those early Western trials failed. And here's the crucial point. The problem wasn't the D2 concept, it was all about technique and experience. Specifically, not taking out the spleen and pancreas was the game changer for reducing complications. And this led to the modern D2 gastrectomy, one that's all about preserving those key organs. With this refined technique, the evidence finally established a new, modern standard of care. Meta-analyses sealed the deal. A modern, organ-preserving D2 gives much better cancer control. Of course, if a safe D2 is impossible, then adjuvant therapies are there to help compensate. So what's the big take-home message for practice and, for your exams? The bottom line, your exam pearl is this. D2 gastrectomy is the standard for resectable gastric cancer.